Well, I think these technologies provide a much more sophisticated mechanism of assessing a patient's disease status as opposed to the traditional methods of physical exam and imaging studies, which are not necessarily as reliable and as accurate. So we are able to get a much more accurate and much more in-depth and comprehensive status of a patient's disease status um, through these technologies, which have made it possible for us to make treatment changes earlier than we were able to in the past, or continue the treatments if we find out based on the genomic analyses from these tests that the patient is benefiting from them. My understanding of Signatera is that it is a platform and it is a resource that allows us to test for the molecular profiling and the genotype and the genomic profile of a tumor through liquid biopsies. So it is a platform that allows us to, instead of having to conduct invasive procedures in patients, which often has been in the past the only mechanism by which we were able to obtain tissue samples. But Signatera is a resource that allows us to avoid that invasive intervention and determine the molecular profile of a patient's tumor through peripheral blood sampling. Both very good questions and important ones. So the accessibility and availability of the test is limited for a number of reasons. One is insurance approvals and FDA approvals, not in that sequence, but also the cost of the tests. And the second is with the current COVID-19 situation, it is not a test that is easily available to most patients who are unable to travel to the clinic to get testing done. So the expanded access program, especially in our patient population in public health systems, allows for patients who otherwise would not be able to pay for these tests, as well as be able to get them in an institution. My understanding is that there are services that allow for the test to be performed at the patient's residence at their homes. So the expanded access program allows for accessibility of this test, which is crucial in decision-making to a much larger cohort of patients than otherwise would be possible. Surveillance is especially important during this time. It's important at all times, but especially during this time when patients are hesitant to personally visit their providers for fear of contracting the COVID-19 infection. And the reverse is also true, where providers may not be available on site or in person to be able to see the patients. And therefore, this testing allows for assessment of a patient's tumor status and treatment status, which otherwise may have been delayed and is being delayed, in fact, when we are not able to conduct these tests because of those limitations due to the fear of the COVID-19 pandemic. So it is certainly of significant benefit for patients as well as providers to be able to have this test available to be able to make more timely treatment decisions. A patient who was diagnosed with stage 2 non-small cell lung cancer about 4 years ago, underwent surgery followed by adjuvant chemotherapy, and then had recurrence of her disease. We biopsied one of the sites of recurrences, which showed the presence of an EGFR mutation. She was initiated on EGFR-directed therapy, but about 9 to 10 months later progressed. Um, but for the last 2 years, since she has had progression on EGFR-directed therapy, we have not been able to obtain tissue sampling to determine whether or not she has a resistance mutation or any other actionable targets because of difficulty accessing her tissue or sites of metastatic disease, or having enough samples to be able to perform molecular profiling. So this particular platform has allowed me within the last few weeks to obtain a sample of her or a blood sample to be able to send for Guardian 360 testing and determining potential actionable targets, including any acquired mutations from anti-EGFR therapy, so that I can then help her with treatment decisions in the future. There are a few other examples of patients with other tumor types where I feel that there would be tremendous value to this intervention. I think there is more that is not known about COVID-19 than is known. So as much as we all know in common, which is whatever practices we can embrace that allow for mitigation of this infection and allow for containment of the infection. As far as cancer care is concerned, that is where my immediate concern is for the patients, where we know that cancer care is being affected adversely at several levels, from screening to diagnosis to intervention with treatments. But the liquid biopsy platform allows for overcoming some of those barriers and hurdles, especially during this time where it is reasonably safe and proficient to be able to obtain a blood sample and assess for any possible signals of malignancy, or also the status of their disease if they have an established diagnosis of cancer, and intervene in a timely manner to avoid adverse or detrimental outcomes from their cancer diagnosis.